Karnataka itself, the cost of treatment and diagnostic tests has increased by 20% at hospitals under the Department of Medical Education in Karnataka. Hike, which took effect recently, applies to hospitals affiliated with the Bangalore Medical College and Research Institute, BMCRI, and other medical institutions across the state. Now, the price revision, which has come in after 5 to 6 years, aims to support the maintenance of these hospitals. While not all services have become expensive, some treatments, surgeries, diagnostic tests and scans have seen price hikes. For example, ward charges have increased because food is now included in inpatient charges, which was previously not covered. Cost for a shared special ward has risen from 750 rupees to 1000 rupees, while the cost for a single bed special ward has jumped from 750 rupees to 2000 rupees. General ward charges have gone up from rupees 15 to rupees 20. Other increases include OPD registration charges, which have doubled from rupees 10 to rupees 20, and inpatient registration fees, which has gone up from rupees 25 to rupees 50. Bed charges for inpatient services have also risen from rupees 30 to rupees 50. Post-mortem and medical examination fees have also been revised as well. However, the government will continue to cover treatment costs for below poverty line cardholders. In cases where patients cannot afford the increased charges, hospital director can waive the fees. Let's go back to our colleague Vaji to understand this in greater depth. Vaji, this is yet another modification, if we may call it so, made to an existing particular provisions that were given to a certain class of people in Karnataka. Plenty of such changes being seen in the recent times. Do bring us the details of this particular new measures that had to be imposed and implemented with regards to hospitals, but also it shows that there is some sort of a financial instability in all probability in Karnataka right now with such changes coming in. And what is the basis on which such changes are coming in and are being made on the ground?
Well, we asked this question to the health minister yesterday, and he said that these are not something that is new. Every 3 years, there is a provision to the government to change the rates of the hospital, to hike them. But in the last 5 to 6 years, there has not been any change with regards to fees and with regards to other things that they're giving in hospitals to the government, in government hospitals especially. And that is why right now, because there's not been any hike, the quality of medical facilities in the hospitals are deteriorating, and that is why they will have to boost that. And that is one of the reasons why they've been they've put a 20% hike in almost all the services that there are there in your medical field, with regards to your diagnostics, with regards to blood samples, with regards to registration. So all these things have been increased by 20% so that they can uplift the medical facilities in Bengaluru. Bengaluru otherwise also has Karnataka especially also has one of the best government hospital services. But to make it even more advanced is something that is why they're hiking these 20% rise. But what we also got to know today is that the government is also planning to see if they can have another guarantee scheme with regards to medical facilities, with regards to poor people who cannot afford high medical prices, and have a certain a plan in which they can also accommodate health services also in these guarantees. And that is why they are trying to boost up their revenue so that they will be able to cater to another guarantee scheme in the coming future. That is what Dinesh Gundu Rao said today in a speech. So the government on one hand is trying to justify this hike by saying that this is only done to make sure that the government hospitals have better facilities, better services when it comes to medical colleges. But what we also need to understand is hospitals like Victoria Hospital, Bangalore Medical College, these were hospitals where poor people could get services with cheaper prices, which comparatively to other private hospitals is humongous. In fact, if you go buy a medicine in Victoria Hospital, you will get 70% discount. But right outside Victoria Hospital, you would be sold the same medicine for MRP prices. So now how it is going to affect the Aam Aadmi, and Aam Aadmi who's taking that medicine for 25 rupees will now somehow be selling 50 rupees for that medicine. He's be bringing out 25 rupees extra from his pocket. So this is how Aam Aadmi is going to affect, but we'll have to wait and watch how the future holds.
You know, it comes in quite as a contradiction at this very given point, given the controversies that have already cropped up with regards to the existing guarantees, now that they are trying to bring in another guarantee while already hiking the prices. So definitely quite a challenge it seems at this given point. We'll have to keep a track of how things work out in Karnataka, and we'll keep coming back to you for all the updates. But well, thank you for